Hello, shade lovers. Welcome to the continuation of blood pressure management in kidney failure, where I've already spoken about ARBs and how they call it, AC inhibitors, where their main aim is to slow down the progression, the damage to the kidneys, and also help reduce the proteins that's appearing in the urine. We've got the ones for the fluid overload, where the fluid overload presents as people having swollen legs and all that. And what happens in here, we've got a furosemide, which is going to help with regards to dealing with that kind of situation. But where you've got very acute fluid overload or long term where the patient is not responding, sometimes medical team or the specialist could also consider adding some of the thiazide, which such as metolazone. And when you look on the screen, you see a diagram where at the end, after the U shape, you see at the end, that's what we call the distal convoluted tubule. And these drugs work over there, and in effect, they totally help reduce the fluid that's accumulated in the system. But here's the precautions or the measures that has to be noted, because when you've got two water tablets being used at the same time, it could cause a large amount of water being lost, and it could cause dehydration. It could result in electrolyte imbalance, and that could even trigger arrhythmia, that's irregular heartbeat. So this will be subject to the medical teams reviewing and monitoring. It requires critical monitoring. So that's got to do with the fluid overload. The next thing I'm going to talk about is got to do with additional blood pressure medications that will be added on to help manage the hypertension. And then that class of antihypertensive medication is known as the calcium channel blockers. So I'm just going to summarize it for you. With regards to the calcium channel blockers, we've got two main classes and we've got new classes. So with the two main classes, it's got to do with dihydropyridine and non-dihydropyridine. So your dihydropyridine is got to do with your amlodipine, felodipine, nifedipine, and the non-dihydropyridine is got to do with your verapamil or diltiazem. So I'm going to continue this in the next video. Thank you, shade lovers.